So today I'm going to be talking to you about patient flow optimization and how we can use evidence-based management practices to improve this within our organization.
So what is patient flow optimization? Well, patient flow optimization is the process of moving patients effectively and efficiently through the healthcare system to meet all of their medical needs. And some of the major goals and objectives of patient flow optimization are improved patient satisfaction, safety and outcomes, as well as better utilization of resources, which means decreased waste and improved overall operational efficiency for organizations. So some of the disruptions to patient flow that we are experiencing here at Mercy West Emergency Department is crowding at our check-in areas. Currently, we are using secretaries to complete symptoms checking, get insurance information and background information, everything like that. This process is taking too long. We're having backups of patients, and this is causing crowding at our check-in areas. We're also experiencing crowding in nurse triage areas where there's too many patients for the triage area. The demand is exceeding the capacity. We are also experiencing long waiting times for patients, which is oftentimes leading to patients leaving the emergency department or not receiving the care that they came for. These are all very important disruptions to patient flow and need to be addressed with proper patient flow optimization management practices. So what's the big deal? Why does patient flow optimization matter to an organization, to a society? Why should you care? Well, not only does this affect the organization, but it also affects the patients and providers as well. Poor patient flow optimization can lead to worse health outcomes for both patients and providers. Patients are not receiving the care that they need when patient flow optimization is poor. Patient satisfaction is also decreased because of poor patient flow optimization. When there is an overflow of patients and they are not receiving care in a timely and efficient manner, this causes patients to have negative feelings toward healthcare or towards their experience, and this may make them less likely to seek care. Like I said earlier, patients are leaving our emergency department, and this is very common in many emergency departments across the United States, and they are less likely to come back because they do not want to have the same experience, they do not have time, they do not feel that they are being properly taken care of, and this creates a negative emotion towards healthcare. Poor patient flow optimization also creates staff burnout and stress. As I said earlier, with the nurse triage, this process can be fairly stressful as nurses and providers are constantly trying to play catch up and see as many patients as they can. This can also lead to worse health outcomes because not only are they trying to focus on seeing as many patients as they can, they also are trying to focus on giving quality care. And these two things are very hard to do at once. One thing often has to give, and this is leading to staff burnout and stress, as well as decreased quality of care. Society as a whole is impacted by poor patient flow optimization as hospitals are for societies. They are a place for people to come to and receive the care that they deserve, and patient flow optimization impacts many different tiers in society, and we must make sure that we are improving this in our organization. To tackle this operational issue of patient flow optimization, healthcare managers can begin to address this issue by identifying key themes and barriers to optimal patient flow so that specific solutions can be catered to the area that they affect, and the organization can improve its overall patient flow optimization. So the key themes of barriers to patient flow are entry into the ED, which we identified as the crowding of check-in areas, the transfer of patients, which we identified as the nurse triage area, and categorizing patients based on their medical needs, which is resulting in patient numbers exceeding department capacities. The internal treatment of patients within the ED, or the quality of care that is resulting from the current patient flow of our organization. The patient flow management system and processes, and the discharge of patients from the hospital. So this is a basic hospital-wide process model that was developed in a systematic review of literature on throughput barriers in hospital-wide patient processes by Philip Allen. And I think this kind of helps visualize where barriers may be introduced. And as you can see, an entire organization is connected, whether this is in an outpatient clinic or an entire hospital system, such as the ED, moving patients in and out of different departments. Optimal patient flow is highly important. So the improvement of management of operations could help to increase the optimization of patient flow in our organization. And the ways that we can do this is by the use of clear communication and the use of command centers, which is basically a meeting between all of the team members who are in charge of hospital operations, where they can come together and discuss demand and patient flow and overall efficiency, performance, productivity, come up with data and information to use in huddles that will essentially help providers and staff deal with the levels of patients that they are receiving. Another approach that we can include in this communication is the lean management approach, and we can do this by assessing the operations and the possible barriers to patient flow, and then come up with solutions for these problems. And we can also use data and analytics tools to collect all of this information to get us accurate data and real-time data so that we are properly prepared for the demand that we are going to receive and increase the patient flow. So healthcare managers can introduce simulations or prototyping, and the point of this is to test out these methods before they are implemented into the whole organization. And the first way that we can introduce this is by adding additional doctors or nurses to triage areas to see if this may impact the crowding in the triage areas and the backflow of patients. Another area that we could use this is in streaming. Another phrase for streaming is see and treat. And this is essentially the process of allocating similar patients according to their severity or their complaint or their disease that they are being seen for to designated staff in the ED. And this requires having an additional doctor, nurse practitioner, or PA in the ED to see and treat these less severe patients so that we can prioritize the patients who have immediate medical needs. We can also implement simulations of point of care testing where blood work and labs may be done in the emergency department to see if this improves wait times and crowding in the emergency department, as many medical conditions or diagnoses may be ruled out with the early testing of blood work in the emergency department. Now we can use all of these with simulations and prototyping, and before we implement them, we can test them out on a smaller population to see if they may have an improvement on patient flow optimization.